Okay, so this week in lab, you want to be prepared for the experiment that we're going to do. So there's a couple things you'll want to take a look at. First of all, the PowerPoint that goes along with this video. So there you can kind of look at the individual slides and also view the video that is hyperlinked within there related to vectors. Then you'll want to take a look at the Heart Sounds guide that has some explanations about what we're looking at as we do the Heart Sounds protocol. And both of these things relate to the Power Lab experiment that we'll do in lab. And finally, the workbook assignment. And the workbook assignment this week actually is a guide to a portion of the visible body software, specifically the circulatory package. You'll find an area from the home screen that says Show, and there's a number of different chapters that walk you through the circulatory system. For these questions, you're specifically interested in Chapter 8 and 9. And there are some great animations in there that will help you to understand better this conduction system as you're trying to learn it. So please watch the video and get ready for lab next week. Hello, everyone. This week in lab, we'll cover the conduction system of the heart and the electrocardiogram. Very basically, the electrocardiogram is a way that we look at the electrical signals moving through the heart. And what we're actually looking at is the depolarization of the myocardium, not the contraction. The contraction, of course, should follow the depolarization. So what we are looking at is the depolarization wave that moves across the heart. And the diagram over to the left has some interesting facts, but it also shows the basic arrangement of autorhythmic fibers within the myocardium. Now, these autorhythmic fibers depolarize on their own. That means that they need no outside stimulus to regulate this rhythm. So the most famous of these areas of the heart is, of course, the sinoatrial node, and that is the pacemaker of the heart. This diagram shows how these areas depolarize, and then that depolarization spreads through the chambers of the heart in order to coordinate the heart's contraction to push blood from one region to the next. So what we see in the first one is the SA node and the AV node. The SA node is, of course, called the sinoatrial node, and the AV node is called the atrioventricular node. So the SA node depolarizes and allows a signal to pass across the atria, and then that reaches the area of the AV node. The AV node then would depolarize, and that signal would move down the interventricular septum, and finally this signal comes up the walls of the ventricles. Now, it's important to distinguish between the action potential and the ECG. So the action potential, we were looking at an individual cell and the changes in electrical activity across the membrane. So this action potential shows us as the cell becomes more positive on the inside. The ECG shows us the net electrical movement of charge in between two areas, a dipole that we set up on the body called a lead. And in the next couple slides, I'll go over the way that we set up these leads in order to have an arrangement that we can get different views of the heart. So just some basic things to go over again here, just to remind you about the action potential and what we're looking at. We have a resting membrane potential within the cell that is negative. And what happens is when the membrane depolarizes, inside the cell, we become more positive. What's happening outside of the cell be observed as a negative wave sweeping over the outside of the cell, and in this case, the myocardium. So what we're looking at with the ECG is a negative charge wave sweeping over the outside of the cell. And this is in the case of depolarization. I'll talk about repolarization several slides in. If you have not taken physics, it's important to just go over a couple things related to something that we call vectors. Now, vectors are used in mathematics and physics to represent physical quantities that have both magnitude and direction. So they have some degree of how great they are or how small they are in their magnitude, and then they have a direction that can be represented here in the two-dimensional axis, so either in the x or the y plane. I'll discuss vectors and just give you a basic understanding of this related to the ECG. And you may want to check out the video. It's only about 6 minutes of material that you can just view and get a better idea about what vectors represent. This is actually a Sol-Con video, so I think you'll enjoy it, and it might get you up to speed if you've not seen this concept before. Now, once we have understood that what we're looking at is not just one action potential, but we're looking at the net electrical charge moving over the heart. We then want to look at the way we set up leads across the body. And for today's class, we're basically setting up the leads so that we can do view three different leads. And this is a lead 1, a lead 2, and a lead 3. And the basic diagram that we use to set this up is called Einthoven's triangle. And I think the easiest way to remember this is that you're basically standing there with your arms out to the side. And what you think about first in setting up these leads is that you want both of the negative leads, or the ends of two negative leads of this triangle, to be on the right arm. Now, what you want to do is put the positives as far away as you can. So you're going to put 2 positives on the leg, and then you'll put the remaining positives and negatives on the left arm. So this is a way to remember that we start with the right arm, 2 negatives over there, 2 positives on the left leg, and we have to put that other positive someplace far away, so we're going to put that on the left arm. And what this does is it sets up 3 different dipoles. So 3 different ways that we can be running a small current through the body and see the way this current is influenced by what's actually going on in the heart. So remember Einthoven's triangle, you'll see it. It's important to understand as we look at the way that the depolarization propagates through the heart. Just as an example, we'll start with looking at what's happening right from the SA node. Now the SA node, we said, of course, depolarizes, and that depolarization spreads across the atria. So what we have is 3 arrows up here that are showing the direction of depolarization. And these are a bunch of different action potentials moving across the myocardium. So what we're actually seeing is this negative wave, this wave front of negatives right here, that's propagating in a direction. And if we had to give it a direction, if we had to say this is the basic direction that it's going in, and this is how great it is, we now draw a vector here, and the vector shows that we're going kind of down and over to the right. So it's on an angle there. And then what we do is we superimpose this vector right into Einthoven's triangle. So this is the same setup that we just looked at on the last page. And for today's lab, and in most cases, the first lead we want to look at is the lead 2 in the ECG. So this lead 2 is actually represented right over here. And we can see that we have this net electrical charge that's heading strongly in the same direction of lead 2. So that means that we have a net electrical negative heading towards the positive end of lead 2. So that's important to recognize. We'll look at this direction change in the vectors, but for right now, just consider this. So the electrocardiogram, again, is going to use electrodes across our body to measure the electrical activity of the heart. The body does act as a conductor for this signal, so that's how we actually can do this, just by connecting some wires to our body with some electrodes. And the ECG does not record individual action potentials. Instead, it's the wave of depolarization. And what we think about with depolarization is this negative wave front moving across the outside of the myocardium. And then repolarization we'd think of as the positive wave front moving back in the other way. So this wave front is just a separation of charge, and what we're really looking at is an electrical dipole, and that's what's allowing us to use the ECG this way to see where the rhythm is going. So once we've set up these positive and negative leads, we then want to look at what's going on with depolarization and repolarization. So these conditions, let's go through them one by one and just discuss what's happening here. So if we have a wave of depolarization, so this is the negative wave front moving towards the positive electrode. In that case, on the chart, we're going to see an upwards deflection or a positive deflection. If the wave of depolarization is traveling away from the positive electrode, then what we have going on is we actually have that negative wave front going towards the negative electrode. And in this case, we see a downwards deflection in our graph, or a negative deflection. Next, we have the case of repolarization. So repolarization is actually a positive wave front moving back across the myocardium. And when we have this positive wave front moving towards a positive electrode, in that case, we have a downwards deflection. And finally, if the wave of repolarization, so this positive wave front, is traveling away from the positive electrode towards the negative electrode, we have the upwards deflection in our graph. So over the next couple slides, watch the animations and make sure that this makes sense to you. You may want to look at one at a time, but just watch the animation and see if you can predict what's actually going to happen in the graph. So here we have the electrocardiogram, and what we're basically looking at is just the electrode that we've set up. So we have the negative lead on one side, the positive on the other. And in the case of the top diagram, we are looking at what occurs when we have a depolarizing cell. So the depolarization is the negative wave front moving towards the positive. And then the repolarizing condition where we have the positive wave front moving towards the positive. And up above, you can look at the graph and see how the deflection is going to appear. So for these different conditions, see if this graph makes sense and discuss this in lab. And hopefully as we go through the different waves in the next couple slides, you'll get a better feel for what's going on. This is the basic ECG trace, and this is what we would call a normal sinus rhythm. This is originating at the sinoatrial node, and we can tell that because we have a P wave preceding the QRS complex and finishing with a T wave. So this is what we expect to see when we look at an ECG. Now, each of these different waves represents a different part of the heart depolarizing or repolarizing, and sometimes two of those. So it's really important to understand these waves, and I'll cover that in the next couple slides here, what's actually going on. Here we have that same diagram we saw before, where we have this basic order of sinoatrial node, atria, interventricular septum, the interventricular septum spreading up the walls of the ventricles, and finally going back the other direction with repolarization. So look at the waves here and use your PowerPoint slides to go through this at your own rate to understand what's going on as each of these waves appear. They all represent electrical events within the heart. Again, this is the P wave, and the P wave, what we can see is we are looking at a net electrical dipole going in the direction of the positive electrode. So this is a negative wavefront moving across the myocardium down towards the positive, and what we expect to see here is a positive deflection for the P wave. So that's what we see. Now, moving to this next slide, we're looking at the more complex QRS complex. So this is the next group of waves that we see as we get past the P wave. And the QRS complex starts with the Q wave. Now, the Q wave is represented as a little dip in lead 2. And what's happening here is that we actually have the interventricular septum depolarizing. And it's going over to the left, as you can see, for the most part, to the left and down a little bit. But what's actually happening is we're heading more towards the negative lead with this negative charge or the negative wavefront. So what we see in that condition is the downwards deflection. As we look at the next wave, the R wave, what we see there is a strong, large magnitude vector going down towards the positive in lead 2. So what we would expect to see is, you guessed it, a big positive deflection in lead 2. So that's what we're seeing with the R wave. Now the S wave represents the depolarization in the left ventricle that's moving across to the right side on your screen. And this is moving more upwards than it is towards the positive. So we're really moving more towards the negative in lead 2. And in this case, we get a slight downwards deflection. So we're going down to baseline, and then we're going a little bit past that in lead 2. Finally, in the ST segment, we have the entire ventricles depolarized, and we get a baseline flat area there. And that is the end of the QRS complex. Now, looking at all these again, I just have some different diagrams, and this shows a red area for when we actually have the atria depolarizing. So what we can see here is the atria depolarizing and a more complex vector diagram of what's going on in these different areas. The R wave, we of course said we were looking at the strong downwards depolarization through the interventricular septum into the ventricle. So that's what we're seeing in this diagram. And then with the S wave, we basically see that final area of the left ventricle depolarizing, and that's going over to the left. So this is where we see that little negative dip in the lead 2. And finally, for the T wave, we get the repolarization. Now we have this positive wavefront spreading exactly in the opposite direction that it did in the past. So we get the T wave representing the repolarization of the ventricles. So this is just a diagram showing what's going on with the T wave. First we see the depolarization, and then we see the repolarization. So that's showing you the difference in how we see a positive deflection in both conditions. It depends on which lead we're looking towards and which way the depolarization is going through the heart. Finally, what we mentioned before was the normal sinus rhythm, and the normal sinus rhythm is up at the top of this diagram here. This normal sinus rhythm indicates that we have the P wave preceding the QRS complex and finally a T wave at the end. These following rhythms are examples of abnormal rhythms where different things are occurring within the heart. And your instructor may talk to you about some of these rhythms. What you might see is later in a clinical class that you discuss these rhythms a bit more. And depending on what areas you might specialize in, you might get to look at these almost every day. Thank you for your attention, and we'll see you in lab next week.